All right. Well, again, I want to thank everybody for being here today. I know how busy everybody is with all that's going on in the world today, but we appreciate you taking the time to be here with us, and hopefully you find a lot of the information useful and beneficial. So again, my name is Gene Kuhn. I'm the Senior Manager of Healthcare Engagement here at the Alzheimer's Association Illinois chapter, and with me today will be my colleague Melissa Tucker. She is the Director of Family Services, and Melissa's going to be doing kind of the bulk of the presentation today, but kind of the way we're expecting things to run down. I'm going to talk a little bit about the Alzheimer's Association. I'll talk a little bit about some of the latest facts and figures, the statistics involved around Alzheimer's disease. Then Melissa will take over and really get into the support services, our 24/7 helpline, our care navigation, give some specific examples or cases of interactions we've had with families, and then get into what families really need to know about Alzheimer's in regards to COVID-19. After that, I'll come back on to talk a little bit about tools and support services available to healthcare professionals, and then we'll get into the question and answer portion of things. One thing I do want to mention is this presentation was really initially geared for healthcare professionals here in Illinois. So I know that there will be some individuals here on from other states, which is great. Most of the information we'll discuss today is available nationwide, but there are a few things that are more chapter specific to us here in Illinois, and I'll point those out here at the very end. And lastly, this webinar is being recorded, so if you have anybody who you think would benefit from seeing this, they can check the website here in the next day or two, and they should be able to watch it here at their leisure. So with all that being said, I'll kind of get into the gist of it here. So first off, just a disclosure form to confirm that we do not have any personal or financial affiliation with this subject matter. And then today our learning objectives to describe the incidence and prevalence of Alzheimer's disease, identify specific tools that will provide a provider with reliable information to enhance care of newly diagnosed patients and families, list 2 ways to connect a family with the Alzheimer's Association, and lastly, how COVID-19 impacts dementia caregivers. So, the Alzheimer's Association, we are a national nonprofit, and our vision, what we're trying to achieve, is a world without Alzheimer's. So we're trying to find a cure, and kind of our mission, so the way we're trying to do that, the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So 3 main areas of focus: research, resources, and education. And I'm going to kind of talk a little bit about those as we go through this presentation. So, facts and figures. Basically, every March, our national office comes out with a facts and figures report. So the latest statistics around Alzheimer's and dementia. So these statistics are hot off the press. If you want to go and read more, you can go on our website and read our facts and figures report. It's about 90 pages of light reading, about the smallest font you could ever find. But if you enjoy that sort of thing, please take a look. So just a couple ones that I'm going to point out here. Right now, more than 5 million Americans are living with Alzheimer's, and that number is expected to nearly triple by the year 2050. About 1 in 3 seniors dies with Alzheimer's or another type of dementia. Right now, it kills more than breast cancer and prostate cancer combined. Alzheimer's disease right now is actually the 6th leading cause of death in the United States, but it's the only one in the top 10 without a way to prevent, treat, or cure it. So unfortunately, it is probably going to move up that list a little bit. In 2020, Alzheimer's of the dementias will cost the nation roughly $305 billion. And by 2050, that number is expected to be somewhere in the range of $1.1 trillion. Right now, there are roughly 16 million Americans who are providing unpaid care for someone with Alzheimer's or another dementia. And that equates to roughly 18.6 billion hours of care, which is valued at $244 billion. This is care that's being provided by someone who is not being paid, who is not being reimbursed. So it's a spouse, it's a family member, it's a friend, it's a neighbor, it's someone at their church, you name it, that's providing that care out of the goodness of their heart. And lastly, right now, the latest kind of stat that we have this year is 50% of primary care physicians believe that the medical profession is not ready for the growing number of people with Alzheimer's or other dementias. That's why education is so important, to let people know really what's out there. And now we have those baby boomers that are really getting to that age range, that's 65 on up, where they're becoming more and more at risk. Until we find a way to slow and treat this, this is going to be a real problem. So, with all that being said, I am now going to turn it over to my colleague, Melissa, and she will take us from here.
All right. Hello. Thanks again for being here. And I'm going to take you through the services that we provide that we hope will be helpful to you during this time and helping your patients and families, and not just during this current situation, but all the time. I'm going to be talking about the 24-hour helpline that we have, about our care navigation service, about our caregiver support groups and early stage programming. I'm really going to be focusing on the helpline and care navigation, but we do want you to be aware of all of the services that we provide. So the first thing I'm going to be talking about is our helpline. This is available 24 hours a day, 7 days a week. You can speak to a licensed clinician or social worker at any time. We moved all of the staff that work on the helpline to be working remotely when this situation with COVID started. So we still have staff available full-time to help you with different situations that families are having. We do have Spanish-speaking staff available at the contact center at the helpline, and other languages are supported by interpreter line. So if someone speaks Polish or Chinese or Korean or any number of other languages, they can still use that helpline and get assistance. So what are some of the kinds of things that people call in with? When should you refer to the Alzheimer's Association? And really, at any time, we're here to provide support for people through every stage of the illness, including pre-diagnosis. We talk to a lot of people who have questions. I think my dad has memory impairment. I'm concerned about myself. I don't know what I should do. We talk to people, we take them through the 10 warning signs. We talk to them about the diagnostic process. So we're there with people right at the very beginning. And it's also important to let you know that we're called the Alzheimer's Association, but we support all forms of dementia, including mild cognitive impairment. So if people are dealing with Lewy body or vascular dementia, we're here to provide assistance for them. So here are a variety of different things that people call us and get help with. Information and referral, just like it sounds. People want a support group. They have questions about what's the difference between Alzheimer's disease and dementia. That's one of the most common things that we get asked. I need to get help during the day. When people start out as caregivers, they may not know about adult daycare or in-home care, about the community care program, and we talk to people about that, and we give them referrals, and we help them become good consumers of those programs. Right now, of course, community care programs are closed, adult day is closed, but we know that in Illinois, the community care program is trying to step up things like Meals and Wheels and in-home care for families that were depending on adult day. So those are services that we talk to people about. How do I get a diagnosis? Again, the diagnostic process is complicated. People don't know really where to start with that. So that's something we provide referrals for diagnostic centers and neurologists in the area, and we tell them some ways to get their loved one to the doctor. And we provide this information over the phone, and we mail or email the referrals and information to the caller so that they have that after the call. So care consultation. So the helpline is not just for information and referral. We handle more complex cases over the phone. This is why we have licensed clinicians available at all times, social workers and counselors. So if someone calls in and there's a difficult family dynamic, a safety situation, behavioral issues, common scenario would be mom's been taking care of dad and now mom's gotten sick and the kids are not sure what to do at that point. Or you've got a person with dementia living alone and resistant to care, you've got safety concerns about that. We have people on the helpline who are really experts who can walk people through what their options are and what they should do in those scenarios. So I'm going to do a couple of brief little cases here on the helpline. I think my father has dementia, but I can't get him to go to the doctor. This is a really common scenario. People are afraid of the diagnosis, or they progress in the disease before they get a diagnosis, and they lack insight into the fact that they have impairment. So we talk to that person about we give them information about the diagnostic process. We provide emotional support. That's really important. This is a scary time for people. They're frustrated. Maybe they're feeling angry, or they're just feeling really afraid about what's going to happen next. And we provide emotional support for them through that. And we coach them on how to get them to the doctor. We say things like, tell them that you have a doctor's appointment and you want them to go with you. Or have the doctor call and tell them they need to come in to get a prescription refilled. We coach them on making sure that are they still driving? Do you have a concern about wandering? Do you have a concern about them leaving the stove on? And if any of that's going on, then we walk them through how to cope with that and some possible solutions. A lot of times people who are they've got a loved one who's very resistant to the diagnostic process, and they'll say, well, why should I even get a diagnosis for this person? It's scary. There's no treatment. There's no cure. So why shouldn't I do that? And we explain to them why it's important to pursue a diagnosis. You want to rule out other issues. There's a lot of things that can cause confusion in an older adult. You want to rule that out. You want to get treatment for some of the symptoms. If the person's depressed, that can be treated. There's medication that can help maintain some level of function for some time, and if that's a possibility, you want to explore that as an option. You want to have some time for advanced planning. You want to talk to this person about what they want for future care while they're still able to make that decision. You don't have an indefinite window of time when you can sit down with that person and figure out who's going to be the power of attorney for finances and health care. So the sooner you do that, the better that can be. The more agency the person can have in their own care in the future by making those decisions now. And accessing support, that's really important. The earlier you start getting support, the more robust of a support system you're going to have. So those are all reasons why we encourage people to pursue a diagnosis. Another type of helpline call that we get very frequently: my mom lives alone and won't accept help. Of course, when you've got a vulnerable adult living alone, this is always worrisome. So again, emotional support for the caller. People are afraid, people are frustrated, people don't know what to do. Coaching on communication. How can you communicate with this person who maybe has begun to lack insight into their impairment in a way that will be productive? We talk about therapeutic fibs, how to introduce help to a person so it's not insulting to them or patronizing to them. Assessment of safety issues. Again, what's going on in the house? Are they getting food? Are they getting medication that they need? Is there hoarding going on? That's very common. We talk to people about legal resources they might need. Do they have a power of attorney? If the window has passed for this, do they need to pursue guardianship? And we have referrals for elder law attorneys, including nonprofit legal agencies that can assist with this. Worst case scenario, you might need to get adult protective services involved if you've got someone living alone and they're really in an unsafe situation. And we coach families through that, and we encourage them to make that call, and we kind of tell them what will ensue after that, how adult protective services will work with them and work with the family and the person who possibly has dementia. We encourage them to make the call, and we will make the call. We are mandated reporters, and we report things to adult protective services too. And we also provide ongoing support. When people call us, that's often the first contact that they have with us, but it's not going to be the last contact. We want to provide ongoing support, including support groups, educational programs, so that as they're going through this, they don't feel alone. So other types of calls, these would be crisis calls, and we handle everything up from that very basic call, what's the difference between dementia and Alzheimer's disease, all the way to really serious situations. The person with dementia has become very agitated and aggressive and is possibly a danger to themselves or others. The person with dementia is missing. We provide support during wandering incidences. We help people work with first responders. An overwhelmed caregiver, a caregiver who's just reached their limit and they don't have help, they don't know how to get help, and their own mental or physical well-being is now in jeopardy. And we provide support for all of these different kinds of situations. So care navigation, this is another service. This is kind of a more intense service. So this is a 60 or 90-minute scheduled appointment. So you get care consultation by calling the helpline, and you speak to a counselor or social worker. You can also schedule an appointment. This is a service that's provided in Illinois by Illinois chapter clinicians. It's a scheduled appointment with a licensed counselor or social worker. It's delivered in person in one of our offices. We have regional offices throughout the state, or by phone. Currently, we're delivering all of our services by phone. We are all at home working remotely. Like I'm in my house now giving this webinar, and I'm taking appointments over the phone with people and providing the same kind of support and intervention that we did in person, we're now doing over the phone. So if people are interested in this, they can call the helpline and ask for a scheduled appointment. This includes the caregiver, the primary caregiver, plus other family members who are involved in the care, and the person with dementia if they're early enough to participate in that conversation. And it's really helpful right after a new diagnosis, when that person is thinking about future planning, what kind of care they want in the future, disease education for everybody. This is a really good time to get a family connected with us. It's also helpful if there's increased needs, family conflict, maybe the siblings, some of them believe it's time for placement and some of them are very resistant to that. Having everybody come in and sit down with a counselor or social worker and navigate that can be very helpful. So here's what kind of things we cover in a scheduled care navigation appointment at the Illinois chapter. We talk about care planning. We talk about when the time comes and you need more care in the home, this is how you get that. If you're thinking about the transition into residential care, here are some steps that you can take and some referrals for you for the kinds of residential care you're looking at. I talk about communication techniques very frequently. To me, communication techniques and coping with behaviors really go hand in hand. When someone tells me that they're struggling with a behavior that the person with dementia is having, I ask them about that, and it's things like, well, you know, she doesn't admit she has dementia, or she keeps losing things, or she doesn't want anybody to come in and give her a bath. And those are really symptoms of the disease. That's a normal part of the disease for many people. So what I talk to people about is, how do you approach the person with dementia? You know, a lot of coaching on don't argue. You can't argue with a person with dementia. You're arguing with the dementia, and you're not going to win that. So I talk about how to meet that person where they are, how to validate their emotions rather than responding to what they're arguing with you about, how not to set things up where you're going to fail. You know, if you ask somebody a complicated question, they're not going to be able to answer it. If you say, well, don't you remember you have a doctor's appointment later today, you're going to make that person angry. You're going to get frustrated. It's going to spiral. So I spend a lot of time coaching people on good communication techniques, and I find that's very helpful in decreasing what people are perceiving as behaviors. The combination of disease education, a better understanding of what's going on in the brain of the person with the diagnosis, and improved communication techniques go a long way in creating a better situation for that family. Long-term care planning, again, looking into the future, explaining to people the reality of long-term care. People set themselves up for a lot of guilt when they say at the beginning of this, I'm never going to put my dad in a home, I'm never going to place my wife. And then the reality is 95% of people with a diagnosis do need some kind of residential care, and they really struggle. And they struggle to the point where it's not a safe situation for anybody. So correctly setting expectations with long-term planning can be really helpful. Wandering prevention, again, is also very important. 6 out of 10 people with dementia will wander. So we talk about putting supports in place to prevent that from happening. So care navigation, this scheduled appointment, it's solution focused. It's educational, it's an opportunity to process feelings. Sometimes that's what has to happen first, right after a diagnosis. People need a chance to talk about what they're feeling before they can move on, you know, and have a planning discussion. And a lot of times when they get that diagnosis, there's no time for that. You know, there's no time for the provider to really sit down with them and say to them, here are things to think about. I know you're feeling this way. Here's a place to get emotional support. There may not be an opportunity at the time of diagnosis to provide that support, but we can provide that support. And again, it's the beginning of a relationship with the Alzheimer's Association. This is not one and done. We want to get that person connected with our support groups, with our helpline, with our educational programs, so that we can be a source of support throughout this journey that they're on. So care navigation is not, that says care management, sorry, that should say case management. We're not setting up appointments and making sure that people are taking their medicine. We're not doing like a medical social worker type activities. We don't do home visits. We provide all of our services in our offices or over the phone. It's not psychotherapy. It's not ongoing one-to-one counseling for people. It's not ongoing family therapy for people, but we do recommend that. We do suggest that people pursue that kind of care through other avenues, but that's not what we're providing. And again, it's not medication management or discharge planning, so it's not what a hospital social worker would do. So what do we see as a result of care navigation? And we've done some studies on this. We want to demonstrate that this is an empirically supported intervention. We've done surveys before and after they receive the intervention. We see increased caregiver confidence. Caregivers feel like they know how to manage symptoms better. They have a better disease understanding. They understand that the disease is progressive, and that when the person progresses, that's not a sign of a failure in them as a caregiver. That's a part, unfortunately, of the disease progression. Decreased caregiver isolation. Being a caregiver is extremely isolating. The person with dementia tends to retreat and become more isolated. The person with dementia will stop initiating social activities, and the caregiver sometimes goes along with that. Unfortunately, there's still a lot of stigma around dementia, so people don't talk about it, they don't disclose the diagnosis, and all of that can create a really unfortunate spiral where people are isolated, they're depressed, they feel shame from the stigma, they don't seek out support, and that increases the depression and the frustration. So breaking through that isolation, having a really frank discussion, getting people set up with community supports is really important. Improved communication with the person with dementia, decreasing behaviors, which I talked about, and access to supports and resources in the community, like adult daycare, like a community care program in Illinois, support groups, education programs. If you've never had any dementia in your family, you've never been a caregiver, you probably don't know that adult daycare exists, or you're not aware that there are Medicaid waiver programs that will provide support for the person in the home. And so that's something that we talk to people about. We get them connected with these providers and with nonprofit resources when appropriate. So I'm going to give another case example. This is a pretty typical scenario. Joanne comes in. She's been caring for her husband. They've been married 30 years. He's in the middle stages of Alzheimer's disease. He's still left alone during the day, and he still drives. Joanne's really struggling to communicate with him, and she believes she needs to convince him to accept more care. She believes that she needs to convince him to give up the car keys, and this is not working. And she's begun to express anger and impatience at her husband. He gets anxious when he's left alone. He calls her at work multiple times during the day. He's driving. He's had a few little accidents. She's afraid and anxious. She started to lose her temper with him. She also has health problems of her own, and those are getting worse. She's not taking care of her own health, and the stress of this situation is making things worse. So her grown children come to the meeting with her. They've actually set the appointment, and they begin by expressing a lot of frustration with their mom. They're worried about their dad's safety. They're worried about him being left alone during the day, and they really perceive that she's showing a lack of progress. She's not making the right decisions. She's not moving forward. They're not really empathizing with her difficulty in caring for her husband. They're offering to help, and she's turning them down, so there's a lot of argument. And the beginning of the appointment, there's a lot of mutual frustration expressed. The children aren't really empathetic with the fact that Joanne's changing the way that she's communicating with her spouse, the man that she's been married to for 30 years. Learning a new way of speaking to someone is very difficult. She's also grieving the loss of her partner, and her children aren't really seeing that. And she is not really understanding that you can't convince him that he needs to stop driving. So she's struggling with that. So I focus in this appointment on disease education, and I validate how difficult this is. Learning a new way of communicating is very hard, and I'm going to provide you with some resources for that. I'm going to coach you through that, and I'm going to explain to you what's going on in the disease progression. I'm really going to emphasize the safety. You know, sometimes you have to make decisions to keep someone safe, and that means that the person you're caring for is not going to be very happy with you. But we have to prioritize the safety first. I'm really going to emphasize the need for support for the caregiver, the need for Joanne to engage in some self-care. She has to take care of herself. And the family comes to an agreement after they've had a chance to kind of process all their feelings and their frustration and their concern, their mutual concern, because they are really worried about each other. They agree that the car keys are going to get taken away, in-home care is going to be arranged, and Joanne begins to accept she's going to need to accept help from her children and others. So what was effective in this intervention? Disease education, really understanding it's not denial. A lot of caregivers come in and they're talking about, well, he's in denial, he doesn't accept it, and you just have to explain it's not denial. Anosognosia is a symptom of the illness. It's new information that they can't process. So it's not that it's not psychological denial. They can't understand this new information that's part of the dementia. Once you really get that across to people, the light bulb goes on and they kind of understand, oh, I'm not going to be able to convince him to take the car keys away. I need to do something else about this. Coaching on communication techniques, addressing the family dynamic, really helping the children to understand mom's difficulties, modeling this way of communication that I'm encouraging mom to engage in, modeling that with the whole family so they can see how to kind of engage with someone in a non-confrontational way. Problem solving the barriers to getting more care in the home. Well, he won't accept anybody but me. Well, let's talk about this. Let's see how you can introduce somebody maybe as a friend and ease him into this. And making this immediate plan to take the car keys away for safety. And this is not a specific family. This is a very common collection of issues that arise in care navigation. And this is why it's so helpful to have these family conversations. You have a full 90 minutes to work through some of this stuff and then present them with a plan. So after the care navigation, we give them a written care plan. We mail or email that to them. It's the referrals and the resources that we talked about. It's a follow-up plan. We'll follow up if needed. I follow it up. You know, anytime I'm having a conversation about safety concerns, I follow up with that family. Were the steps we talked about implemented? And this ongoing access to all of our resources, support groups, education programs, involvement in advocacy and walk-in Alzheimer's, which again is another way to be a part of the community and can be empowering for people who are interested in that. So now I'm going to talk about what families and care providers need to know about COVID and Alzheimer's disease. And all of the services that I've talked about, we have switched them to being available virtually. So families who are concerned about COVID, we're all sheltering in place right now. It's really important for you guys to know we're providing all of the services that we've been talking about, and we'll continue to provide them. We're just doing them by phone or by web. So some unique challenges for family. You know, the recommendation for social distancing is not possible for people with dementia. People with dementia depend on others. They can't just be by themselves. Once you get into the middle stages, you're dependent on other people to help you get your medication, have meals, in basic hygiene. You have to have someone there helping you with that once you get into those middle stages. So care providers, professional care providers are closing or restricting visitation right now. So in Illinois, all of the adult daycares shut down a few weeks ago, and this is really creating a hardship for families. Again, in Illinois, if people were getting adult daycare through the community care program, the community care program is trying to increase other services, delivered meals and in-home care. But that's very different. If you had a person with dementia who really enjoyed going to that adult daycare and getting some socializing, that's changed and that's really hard right now. Another factor is that elderly people are more at risk for the more serious symptoms. So that includes people with dementia and their family members. You know, if you've got a couple in their 70s and the wife is taking care of the husband, it's dangerous for both of them to let people in the house to get more care. So this is very anxiety producing. It's really difficult. Is there an increased risk with dementia? We don't believe so. We don't believe that dementia by itself increases the risk for COVID-19. However, many people with dementia are over 65, which increases risk, and many people, older people with dementia, have other health conditions that increase the risk of infection and more serious side effects, and these include heart and lung conditions, so things like COPD, asthma, diabetes, hypertension. I've seen all of those can increase people having a more serious reaction to the infection. So what are some tips for family caregivers? Practice good hygiene, wash your hands 20 seconds, happy birthday twice through, and monitor the hygiene of the person with dementia. This is not easy in the best of times, but it's really important right now. Reminding someone with dementia to wash their hands may not be the most helpful thing. It's probably going to be more helpful if you physically demonstrate washing your hands. If you assist them washing their hands, you might have to cue them through the process. You might have to sing the song twice through, make a little game out of it. But again, just reminding someone, remember to wash your hands a lot. Once they're out of the early stages, probably not that helpful. Follow the CDC recommendations, which I know we're all aware of, but just to go through those. Avoid close contact with sick people. Try to avoid touching your eyes, your nose, and your mouth. Stay home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue out, and wash your hands frequently with soap and water. So again, supervising a person with dementia to get them to be compliant with this is not easy. So if you've got care in the home, be very proactive in monitoring who is coming into your home. If it's another family member, or if you've got paid care coming in, or someone through the community care program, ask them about their health, ask them about how they're feeling. Anticipate changes in care and try to plan for gaps. So you may get less hours from that in-home care provider. The in-home care provider may get sick. They may not feel well. They come down with a little cough, and to be on the safe side, they're not going to come over. And you don't want them in the house if they've got a cough going on. So think about how you can plan for gaps in the care. Maybe you're going to be relying on family members a little more now. Maybe you're going to be asking friends to come over and help you. Pay close attention to flu or pneumonia-like symptoms in the person with dementia, and report them to a medical professional immediately. People with dementia are, again, once they get out of those early stages, are not really going to tell you they're not feeling well necessarily, so you may observe a change in behavior. Anytime that you see confusion increase or agitation increase, this may be an expression of physical discomfort, illness, could be a UTI, or it could be the onset of these flu-like symptoms, and you want to tell their doctor immediately. Planning ahead includes keeping prescriptions filled, getting them mailed to you if you can, monitoring those changes in behavior, being on the lookout for an increase in confusion that might be, they might be starting to get feverish. Trying to create a calm environment. Easier said than done, right? We're all very anxious right now, and people with dementia will often respond to the anxiety of the people around them. So whatever you can do to stay calm and get through this will be helpful. Having some activities that the person likes to do in mind, music, sports, if they like that, TV shows that they like, having that queued up to just give them an activity where they can be in the house. If it's possible to exercise safely, that's a good thing to do too, to help keep everybody calm. If they can walk around the yard, or if they've got a treadmill, if that's safe for them to do. Just doing what you can to keep everybody calm and safe and healthy while we're all getting through this time. In a residential setting, most are now restricting non-essential visitors, and this is really hard on the families. So that's something we're talking to people about. You're not going to be able to go and visit. If the person has to be hospitalized, you're not going to be able to go and visit. That's really hard on people. So ask the facility staff if they can facilitate Skype calls or phone calls so you can stay in touch with that person. If they're already in a skilled nursing facility or residential care, or if they need to go in, see if they can facilitate that. Ask for regular communication from the staff. You're not going to be able to go and visit them, maybe like you used to do, so you're going to have to ask the staff to keep you updated on what's going on. Make sure they have your emergency information. And we also have a link here on our website which goes into this in a lot of detail, so we've included this for you so that you can take a look at all of the things we're recommending for residential care providers and community care providers. And with that, I'm going to turn this back over to Gene.
All right, well, thanks, Melissa. So now I'm going to get into some of the tools and some of the other support services that are available. So in regards to healthcare professionals, we have a ton of information on our website. I am just going to touch on this very, very briefly, but I'm going to show you where it's at. So you know where to look, and you can kind of go through it at your leisure and see what best fits for you. So on our website, the quickest way to really get there is alz.org/clinical care, and I'll show you exactly what that page is going to look like here on the next slide. But some of the tools that are available, that I'll talk about real quick, are our Alzheimer's Disease Pocket Card app. We have a free app. We've joined the technological age here. So this app is going to provide some basic clinical information on the diagnosis and management of Alzheimer's disease and other dementia, as well as provide some interactive tools to help assess cognition, depression, functional status. There's also going to be a lot of educational topic sheets, things that you can print out and give to a family who is in your clinic or in your office here right then and there. Again, a lot of information. It can be downloaded on your phone, on your tablet. You can even bookmark it on your desktop browser. But again, take a look, see some of the things in there. We also have a free CME on the website, Challenging Conversations About Dementia, which is fantastic. So even if you don't need CMEs, it's still good to listen because there's a lot of very difficult conversations around dementia. So it's a great opportunity to kind of listen to some of those. They have some videos kind of going through it, some tips, some techniques, etc. We have our cognitive impairment planning kit. So cognitive decline, including Alzheimer's disease, other dementias, can be difficult and very time-consuming to discuss with patients. And although in-depth care planning is beneficial for all, in the past, this type of service has not been covered under Medicare until recently. So the CPT code 99483 helps provide reimbursement for person-centered care planning, allowing you to help deliver those services that can contribute to a higher quality of life for your patients. So if you go on the website, you can download the whole planning kit. It will literally walk you through it step by step in terms of what needs to be done, who qualifies for this, and so on and so forth. And lastly, Project ECHO, our extension for community healthcare outcomes. This is a pilot that we've been doing. Some of you may have used Project ECHO in other things, throughout your career. But this is a free telementoring program that uses video conferencing technology to help build workforce capacity and improve access to specialty care in local communities. So it is case-based learning. You get your team together and you discuss different cases. You have the opportunity to learn, the opportunity to teach, and this is nationwide. So you're gonna have the opportunity to work with healthcare professionals from all over the country. It's basically a 6-month program. It is provided every other week. So I believe there's 12 sessions. So you don't have to be on every session, but we do ask that someone from your team is on every session that can share the information. So I believe we started our last session here in March. So we'll have something again here in the fall. The most recent development is I believe they are offering education credits for this as well. So take a look. If you're in another state, talk to your local chapter, let them know you're interested, or there's a contact us page on the website where you can contact us to gather more information as well. So on the website, again, you go to the alz.org/clinical care. This is what's going to come up, the tools for healthcare professionals. This is exactly what the page is going to look like. So diagnostic and management tools, cognitive assessment, dementia diagnosis, management, care planning, and then a lot of information for your patients and caregivers. Again, each hospital, each clinic, each practice is different. So take a look and see what best fits you. What is going to benefit your families and your patients the most? At least knowing where those resources are is half the battle. But there's a plethora of free information there. Take advantage. Use it. If you have questions, call us. We'll help walk you through it. So now on to other support services. Like Melissa mentioned a few times, everything we're doing now is virtual. So nothing has changed for us. Also, the best part about what we're doing right now, or what we've been doing for forever, everything's free. So take advantage of of our support services. Melissa's gone in depth on our helpline, so I'm not going to really hit on that. But I go all over the state working with providers and their teams, and that helpline number is the thing I give out the most because it really is a one-stop shop for families for whatever they need, whether it's asking questions, getting local resources and support, or even through those crisis situations, being able to talk to somebody in real time that can help. And always having the ability to talk to a live person. No answering machines. You're gonna be able to talk to the person, pretty much, right then and there, which is great. Always having that ability to talk to a live person. I've mentioned briefly the website, alz.org/Illinois for our local Illinois chapter. Again, there's a ton of information. It'll keep you busy for months. There's education, there's videos, there's fact sheets, you name it. Peruse it at your leisure. But this is a great opportunity, great resource for families as well, that can give them a lot of basic education. Again, Melissa's gone in depth on the care navigation. That is a huge resource for families. Every medical practice is a little bit different. Not all have a social worker. I wish they did, but not all of them do. So this is an opportunity for a family to really speak with a licensed social worker or a licensed counselor to really work on that that support side of things, to make sure the family is all on the same page and everybody has what they need. Support groups, I can't speak highly enough about support groups. They are so valuable for a family, just to know that they're not alone, that there are other people out there going through something just like they are, the ability to learn from others. I've known families where they've lost their loved one a couple years prior, and they've continued to go to a support group for several years after the fact, just to really share what it is that they've learned and what they went through. So education is the key. The more a family knows, the better prepared they are for what may happen next on this journey. So we do a lot of education for families. We have an entire team here at Illinois, I believe 10 or 11 individuals that go all throughout the state, and they do those community education programs in senior centers, in libraries, in retirement communities, you name it. Really just educating the families on more about this disease and what's out there. So here's some of the programs that we do. Know the 10 Signs, that's probably our most popular one. Healthy Living for Your Brain and Body. That one talks a little bit more about brain health and how it, how a diet and exercise and staying cognitively active can affect your brain health, but also communication, behavior, legal and financial, living with Alzheimer's, a lot of information. And now we're doing these programs online. So we have webinars every month that families can log into for free to listen, to find out more. A family can never have enough education. There's always more. So again, go to our website. You can find the full list of what's coming up, encourage your families to participate. So one of the other things that we've been facing as a chapter is how to engage with families earlier in this process as opposed to later. One of the things we see all the time, and I'm sure all of you see it as well, is that families continuously wait for a crisis to occur before asking for help. Well, we're trying to change that. So, in order to refer families, in order to connect a family with the association or to refer here, there's two main ways. One is we have these little purple business cards that have our helpline on it. We give those out, all the time. It's something very quick and easy to give to a family. Say, give them the card, give the association a call, they'll help you out. So I know providers love it. The problem is families don't call. They get that card, life gets in the way, they get busy, they lose it, they put it on the back burner, whatever it is, and they don't call. Again, they wait for that crisis to occur before asking for help. So we've developed a referral program called Direct Connect that will help engage earlier in that process. So the way it works is instead of waiting for that family to call us, we will call them. So when you see kind of our paper version of the form here on your screen, so the way it works is the family fills out the top half. Who's the patient? Who are we calling? What's a good time to call? And kind of that middle paragraph there basically states that the family is giving permission for you as the provider or any member on your team to send their information to us. We are not asking for the medical records. We are not asking for the medical history. We are just asking for basic contact information. But also in that paragraph, there's also a little line in there that says that the family is allowing us to report back to you. And we can provide a very simple report back to the provider saying, hey, we spoke to this family on this date. This is what we spoke about. Call if you have any questions. The family has to give consent. They have to either sign off or there's a little box that says that they gave verbal consent. The bottom half of that form is one that's filled out by the provider, so we know where it came from. And then for the paper form, you can either fax or email this form to us. It's all HIPAA compliant, safe, secure, and then we're going to get it. And then probably within about a week's time, we'll reach out to that family to introduce ourselves. So in these cases, sometimes the family's right away, they're ready to talk. Other times they don't have questions, they aren't quite ready. We'll just kind of introduce ourselves, explain, here's a little bit about what we do, call us when you need us. And what we're seeing is those families are calling us back. They're asking questions, they are engaging, which is actually absolutely what we want to see. So that was the paper form. We also have an online form. So the quickest way to get there, if you look at number 2 here, alzheimers-illinois.org/direct connect, it's going to take you to the page to look directly, exactly like what you see at the left-hand side here. So you have an online form. You also have the paper form you can download. The online form has become very, very popular here recently with all that's going on because we do know a lot of providers are doing more telemedicine. They are working from home and talking with families over the phone or via Skype or what have you. So this is something you can get a verbal consent from that family, type in all the information, send it to us, it comes to us encrypted, we will then reach out and call that family. Both processes work pretty much exactly the same. It's whatever's a preference for you. We have no preference. But what I can tell you is that we are going to have much higher odds of connecting with that family using this direct connect process as opposed to just giving them our helpline number. So this is something we've been using the last couple of years throughout a lot of the major health systems here in Illinois. It's gone over great. So it keeps growing and growing. So while you're, if you are working from home, a family can never have enough support. Please try it. Try it out. See what you think. If you have questions, you can always give us a call. So I mentioned a little bit earlier in this presentation that some of this stuff is specific to Illinois, to our chapter. This is one of them. Unfortunately, not every chapter out there has the Direct Connect program. Some of them just don't have the staff to be able to do this. And if they do have Direct Connect, it might look a little bit different. So like our paper form, that one is the one we created here in Illinois. So it most certainly will look different than other chapters. And then the online form, that's available. We are one of 4 or 5 chapters around the country that have that. It's kind of part of a pilot program. So what I would recommend, if this is something you are interested in and want to learn more, and you are out of state, contact your local chapter. See what they have available. See if they have Direct Connect or something similar, or what they feel is the best way for you to connect your patients with the Alzheimer's Association. So just to kind of finish up here real quick, some of the benefits, just to kind of summarize everything Melissa and I spoke about, in regards to that helpline, the main things that we can do is really help answer some of those general questions rather than having your staff take the time to do it. We can do that. We can help with that after hours assistance, always talk to a live person, helping through those crisis situations, active listening. Sometimes a family just needs to talk. Well, we can be there. We can take that time to listen, to empathize, to reassure that they're doing the right thing. Help provide some of those caregiver tips in the home, those difficult conversations, how to approach those. Help with local resources in the community, even specialized packets of information. I know right now we're doing everything virtually, but when we're back in the office, our helplines, our team, they will mail specific information to families. We do our best to try not overload a family, to overwhelm them, because then we find materials end up in the trash. But if they need something on behaviors now and communication next month and driving the month after that, you bet we will get them that information. And specifically when it comes to the Direct Connect program, it's a really quick and easy way to connect a family with the Alzheimer's Association. It really helps engage that family earlier in the process when we can make the biggest difference. Maybe we can help change the trajectory of that crisis. Like Melissa mentioned, we can help with that care planning on the social side, and then also help provide that follow-up report to the provider to let you know we did speak with them and we're able to kind of help them out a little bit. So with all of that being said, I am now going to turn it back over to Mike Bias, and he'll kind of help moderate some of the questions that you might have, and we'll do our best to answer them.
Alrighty, Melissa Tucker below me and Jean Kuhn below her. If we have any questions, you can just go ahead and type those into the chat pod, and we will go ahead and address them. The first one, Melissa Tucker, is there anything that comes top of mind that you would recommend as the #1 thing to think about with respect to families dealing with dementia in light of COVID-19? I realize you talked a lot about that, but this person's wondering, is there the top 1 or 2 things?
Well, I think the first thing that people need to think about is just keeping everybody safe, which means really monitoring who is coming into the home. If you're an elderly person, you have to be aware of your own safety as well, and also keeping in mind that this is a very stressful time, and whatever you've got going on with that person with dementia might become exacerbated just because of the stress of it. So keep everybody safe, monitor hygiene, monitor your own hygiene. If you notice any change in the person's cognition, they become more confused or they become more agitated, be concerned that they might be getting sick and notify their healthcare provider.
Okay, are persons with dementia, whether Alzheimer's or anything else, at a higher risk for COVID-19, the coronavirus?
So we don't believe so. We don't see a link between dementia specifically and getting COVID-19, but people with dementia are in categories that are more likely to become infected or to have more severe symptoms. So people with dementia are mostly older people, and a lot of older people and people with dementia have other health conditions like diabetes or hypertension or lung conditions like asthma and COPD, and those can increase risk of infection and also risk of more severe side effects.
Okay, you mentioned a care consultation appointment. Is this with a credentialed specialist? What is the cost, and is it covered by insurance?
So all of our services at the Illinois chapter are offered free of charge. We don't charge, we don't bill insurance. Anybody can get a care consultation all across the country. I know that there are people from outside Illinois on this webinar. You can call that helpline number that you see on the PowerPoint, and you can get a care consultation from a licensed clinician, that's a licensed social worker or counselor, at any time. You can also, in Illinois, make an appointment to have an hour-long or 90-minute long appointment. And before all of this happened, we were doing those in our regional offices. Now we're doing them all over the phone. So anybody can have a care consultation. They're licensed clinical social workers or counselors, and there's no charge for that.
Great. This is a tough one because I don't think there is no single test to used to diagnose dementia or Alzheimer's. But if you had to choose a test or an exam to tweak out dementia, which single test would it be?
So the Alzheimer's Association, and Jean can correct me, Jean is more on the healthcare side of things and I'm in the family services side of things. We recommend a full diagnostic workup for people who are concerned about memory loss. I don't believe, Jean, that we have a specific neurocog exam that we say this is the gold standard. There's a variety of testing that goes on, and we recommend a full workup, and that include imaging, family history, blood work, and also there's a series of neurocognitive tests that people take.
That's correct, Melissa. The Alzheimer's Association, we don't endorse one specific tool to diagnose. It really comes down to the physician, what they're comfortable with, where their level of expertise lies. But basically, you want your doctor to rule out everything else first before coming to that diagnosis of Alzheimer's disease. And then you want to ask them, okay, how did you get to that diagnosis? So that's kind of the big thing right there. There's a lot that goes into this. This is not a 30-minute test, and then you have an Alzheimer's diagnosis. This should go over for a long period of time because, again, they want to rule everything else out first before they come to this. You could go on our website. One of the slides that I mentioned kind of geared towards healthcare professionals. I think it's cognitive assessment. There are different cognitive assessments out there. You can kind of look through that. If you are a healthcare professional looking for screening tools, if you are looking from a family perspective, talk to your doctor.
Okay, just a note here, we may go a little bit longer today. We respect your time, and if you have to sign off at the top of the hour, we understand that, but we do want to answer all of the questions that are coming in. Next question is, how do you protect other family members if a person with dementia has COVID-19 and wanders in the house? Ooh, that's a tough one.
That is a really tough one. I would recommend speaking to that person's physician and see what they recommend. It might be a matter of quarantining everybody. That's a very difficult situation. You might have to talk to the doctor about where's the best place for this person to receive treatment and care. Some of these questions are they're great questions. I'm probably not going to be able to go into an in-depth discussion, but I want everybody to know that you can call the helpline and speak about your specific situation. So if you have a family where this is going on and you want to help them, give them a call. but yeah, all of the recommendations for protecting people with COVID would apply to a person with dementia, isolation, with family supports as needed, frequent hand washing, coughing into a tissue. All of the CDC recommendations are in play with that. It's a complicated when you've got a person with dementia who's possibly agitated and wandering and doesn't want to sit in their room. So you have to come up with a lot of strategies to help that person stay contented with their situation. That means communication techniques that won't agitate them. That means having activities that would be engaging for them, trying to understand maybe what's stressing them out or causing them to want to wander, and figuring out what that is, validating emotion, and giving them some activities that will help them stay content. It's a very difficult situation.
Yes. Here's a specific to a facility. We have a 28-bed dementia unit that is full. We've been on lockdown for 3 weeks now due to COVID-19. How do you suggest assisting with staff burnout in the dementia unit due to this virus?
That's a very challenging situation. I know that all of us are so grateful and appreciative of the people who are in healthcare systems doing this work. So thank you very much for what you're doing to keep your patients safe and your family safe. So we do have some recommendations on the slide for residential care facilities about managing that, about managing staff burnout. Hopefully everybody has an emergency plan and that you're following that emergency plan to protect everybody. Whatever you can do to keep people feeling safe and calm. I don't have the specific expertise for addressing a long-term care situation and the burnout that you all must be feeling. I think we're looking at planning another one of these that is specifically for long-term care, and we do have, again, some recommendations online. So I wish I could address your specific situation more thoroughly, but I understand you're in a really tough place, and we're all really grateful.
Here's a good one. I have several people calling looking for placement of a person with dementia as the stress of home care while sheltering in place. I fear placement at this time would be a bigger risk than benefit. Thoughts?
Right, so you really have to think about the risk versus the benefit of this. We got a lot of calls sort of as this was shaping up with people saying, should I take my loved one out of the facility? And facilities do have really strong measures in place. They're not allowing outside visitors. They're following a disease protocol. If you've had a person with dementia who is in adult daycare full time, and now they're at home with you because all of the adult daycares in Illinois have shut down, and maybe this is a situation where your elderly mother is taking care of your dad with dementia and it's just going to be too much for her and you're worried about her safety and wellness, have a conversation with the person with dementia's physician and ask them, what do you think is the best thing right now? Can they be admitted? Should they be admitted? Ask the facility, what is your protocol for disease prevention? What is your protocol for communicating with the family? I'm aware that some facilities are doing kind of virtual tours, but you should be able to ask all of these questions and kind of get a sense of what are they doing to keep the people in their facilities safe? Is it a bigger risk or benefit at home or in the facility? That really depends. What might happen if this person is at home? Are they leaving and wandering? Are they physically aggressive and a danger to the other caregivers? Is it even possible to keep them at home during this? It's a really individual question. I discussed that with the person with dementia's healthcare team and also give a call to the helpline so they can really take you through point by point. They'll do a safety assessment and give you some really specific advice for that situation.
Okay, I have several people calling. Oh, I'm sorry, that's the same one. Are there any booklets for the layperson? A person with no real nursing skills that has been inducted into helping or hired to help?
Well, if you are helping out, I'm not sure what your situation is. If you're working for an in-home care agency or a long-term care agency, certainly they should be providing you with the training and the skills that you need. I hope you haven't just been hired and are kind of left in the lurch there. If you're looking for information about caregiving of someone with dementia, we have an enormous amount of information on our website, alz.org, under caregiving. It goes through care that's appropriate, all different stages, including personal care, communication skills, handling behaviors. So if you're a caregiver at home with someone, we have a lot of information that will help you. If you're working in a professional capacity, you would need to look to the people that have employed you to do that.
Great.
We also have, I'm sorry to interrupt you, we also have a lot of information on our website for professionals. If you go to alz.org, professionals, there's information there for people who work in residential care facilities and in-home care providers as well.
Yeah, and I would just encourage you to start with the helpline. ALZ.org has all the resources that you could possibly imagine, but if you can't find it, call the helpline and they'll tell you where to click, because there is a method to the madness. It is ordered and organized pretty logically once you realize how they do it, but an area for families, an area for people with dementia, an area for professionals. So the information is there. Another question, will you be providing the PowerPoint via email? Yes, we will. We'll be sending the notes out, the PowerPoint slides via email. You should have those by Monday. And with that, Jean, are there any final thoughts from your end with respect to educating the families, how professionals can ensure that their families get education? I know that a lot of neurologists nowadays are saying that the most powerful prescription that they can write for a person with dementia to improve the quality of life is education for the families.
Yeah, exactly. Education is key. Sometimes families and also healthcare professionals, sometimes they don't know what they don't know. So with what we do, that education is key, really, to let families know a little bit more about the disease and how it progresses and what may happen next. That can really help change that trajectory going forward if that crisis does happen and they know how to handle it as opposed to not being able to handle it. So as we've kind of talked here, there's a plethora of information on that website you can go through. But the biggest takeaway I want for all of you to know, there's always someone you can talk to, our helpline. It is staffed around the clock and it's free. So for whatever you need, whatever question you have, they may not have all the answers. No one does, but hopefully they're able to point you in that right direction. So please keep that in mind, not for yourself, but also for the families you serve, because I really do think we can be a big resource for all of you.
Great.
And the helpline is used by healthcare professionals too, so you don't just have to be a family caregiver. Healthcare professionals, social workers, CNAs call us all the time, so feel free to reach out.
Melissa has been with the association for quite some time, and she spent a good deal of that time supervising staff taking helpline calls. So, Melissa, can you just give some insight as to the new normal that we're going through now, where currently, during COVID-19, our Alzheimer's Association offices locally are closed, and people might be thinking, well, can I still get everything that I need online or over the phone?
Yeah, 2 or 3 weeks ago, I can't remember what exactly, they moved 100% of Alzheimer's Association staff to work remotely, and that includes the 24-hour helpline. So there's 90 people that work on the helpline, so it's shifts all around the clock. Every one of those people is working from home, and we shifted all of our education programs and support groups to be online, so people probably are noticing, if they're out in the community, that the local regional office is closed, but that doesn't mean that we're not working. We are all working. We're all working remotely, and that includes helpline staff. All of our providers are still working.
Okay, and if there are family members on your end in different locations that need help, or whether it falls into the category of a care consultation or not, they are able to do that. They can accommodate that, where they can do conference calls with numerous people in different locations. So don't think that this coronavirus is going to limit our ability to help you. We're there, and we're ready, and we're very flexible.